thoughts on health? There's still a lot of confusion after President Trump announced acetaminophen, like Tylenol, during pregnancy could increase the risk of autism. The FDA has started alerting doctors about this, but health experts disagree. They say Tylenol remains the safest option for expectant mothers.
So joining us to break this down is Josh Anbar, clinical assistant professor for ASU's College of Health Solutions. Thank you for being here. I appreciate it.
Thank you very much for having me.
Autism, it seems like, is kind of tough to pin down, right? In a lot of ways. We don't exactly know what causes it. It's kind of tough to spot. I mean, go into that for me if you can a little bit.
So autism is what we call a very heterogeneous condition. It presents in a lot of different ways, and it's very unique to the individual who has it. There's a colloquial saying in the autism community: when you've met one person with autism, you have met one person with autism. So
meaning it affects everybody differently.
It affects everybody differently, and the symptoms can vary wildly in terms of severity, in terms of presentation, and what autism looks like for one person may not look like for another person.
And before we get to the Tylenol, you are part of your job is actually looking at statistics of people with autism here in Arizona, correct? You said that. Where are we at now compared to where we were, say, 25 years ago?
Correct. So 25 years ago, the prevalence of autism nationwide and here in Arizona was about 1 in 150. Arizona has participated in public health surveillance efforts to track the prevalence of autism over the last 25 years. And we've closely mirrored the national trends. So currently, the prevalence of autism is 1 in 31. And in Arizona, it's very similar. It's 1 in 32 kids at 8 years of age.
And that's a huge increase over 25 years. Do we know what's behind that?
So it is a significant increase over time, and there's a lot of speculation as to why that has occurred. We've changed the diagnostic criteria for autism over time, and so some have speculated that that has played a role. We also have new and better tools for diagnosing autism and recognizing autism, and we've also improved access tremendously for how people can receive a diagnosis of autism or receive a special education exceptionality for it.
So there could be a number of factors.
There could be a number of factors, yes.
All right, so let's get to the news of the day. Tylenol. For decades, doctors have told expectant mothers that this is probably the safest pain fever reliever that you can use. So what are your thoughts on that?
So, as you said, doctors have recommended that acetaminophen, the generic name for Tylenol, is the safest and really the only pain reliever and fever reducer that pregnant women can take. Most other pain reducers and fever reducers can harm both maternal health and fetal health and child health. And so Tylenol has been deemed the safest. Obviously, it should be taken in consultation with a physician. The announcement on Monday was that there's a potential association between acetaminophen usage during pregnancy and the likelihood that autism occurs.
Are you seeing statistics to back that up?
So that's a complicated question to answer. We have some studies that suggest that an association between acetaminophen usage and autism occurrence does exist, but we also have other studies that say it doesn't. And so the science is very mixed. And what we really need to do before making big, broad-based policy solutions is to really be sure that what we're going to do is going to result in what we hope it will result in, which is controlling the rise in prevalence of autism. And right now, the science is still out.
All right. Josh, thank you so much for joining us and shedding some light on this. Appreciate it.
Thank you.